Hi everyone, my name is Shivalka and I'll be conducting the demo today on behalf of Care Collaborative. Care Collaborative is an AI human compatibility initiative where we provide bedside manner or cultural competency training to healthcare professionals utilizing our AI platform. And to jump right in, we're going to be browsing the patient library. And today we'll be speaking with Sarah Miller, who's a 34-year-old elementary school teacher with a health anxiety disorder. And before we begin, we're going to increase our temperature to 100. Hi, Sarah. Let's take a breath and slow down for a second.
Okay, but I've been having this chest tightness that lasts hours sometimes, and my heart feels like it's skipping beats several times a day. I've read that this could be a sign of some serious heart condition, and my dad died of a heart attack. What if it's really that? The normal tests don't explain why I feel like I can't breathe at times. It's really scaring me.
Thank you for sharing that with me. Can you describe what it felt like this time?
It feels like someone's squeezing my chest really tight, and then I get these sharp, intense palpitations, like my heart skips a beat. It's almost like I'm suffocating, but then I check my oxygen and it's normal, which doesn't make sense. This can't be just anxiety, right?
Okay, and just a question on the side note, but just to confirm, no exertion beforehand, right? You were just sitting and the pain suddenly happened.
Yes, exactly. It happens when I'm just sitting or even lying down. No exertion or anything.
And do you happen to know how long it lasted for this time?
This time it lasted about 2 hours, and it was really distressing the whole time. It just wouldn't go away no matter what I did.
All right, so you've been to the emergency room twice this week, and they did the full workshop. The test results showed all clear.
Yes, they did all the tests like the ECG, cardiac enzymes, chest x ray, and everything came back normal. But I still feel like something's wrong. It just doesn't add up.
I hear you, and I know this must be so scary. I also understand you've been doing a lot of research. Do you mind telling me what kinds of things you've been looking up online?
I've been looking up symptoms of heart disease since that's what it feels like, but then I also came across something about aortic dissection and silent heart attacks. And what about Prinzmetal's angina or small vessel disease? These things can be easily overlooked, and I've read about cases where they were missed in the ER.
Okay, I just wanted you to pause here. It sounds like your brain is in problem-solving mode 24/7, and that has to be exhausting. I want to request you to place your trust in us. We have examined you with our most advanced technology and the best healthcare we can provide. And given the fact that your test results came clear, I want to rest assure you that you're going to be fine.
I appreciate that. And I do feel a bit better knowing everything came back normal. But what if they missed something rare or atypical? It happened to others, right? It just keeps lingering in my mind.
And that's where we're going to end the conversation. I began evaluating our conversation, and the results are going to pop up in a second. Just to highlight that I was able to speak with her regarding her condition, but also, if need be, I can even include increased anxiety or increased emotion, such as crying as a result, which will accordingly alter the conversation. And going back to the assessment, I received a 85 overall, and it shows that the healthcare provider showed a good level of empathy, active listening, and rapport building. However, there's room for improvement in patient education and clarity. The provider could have used simpler language and provided more detailed explanations to address the patient's concerns. And we have a further breakdown, such as visualization, a competency breakdown in each category, such as cultural sensitivity to medical knowledge, and then we even have a summary. That's all. Thank you so much.